Hi, I'm Alan Cordova. I'm one of the clinical psychologists here at Children's Program. So I'd like to share some thoughts about the question of how long should therapy last? If you're not asking that question, we would encourage you to do so. We think it's an important and a relevant question when starting to work with a therapist. So, people seek therapy for many different reasons. And because we have a variety of clinicians here, each with different types of approaches, the answer to the question how long therapy will last, it may differ. In many cases, in fact, if not in most cases, your therapist is more likely to give you a range of sessions. They may say this will be 10 to 15 sessions. That would be a realistic expectation to set. In other cases, it's hard to be specific, and the answer is going to really depend upon what your unique therapy goals are, who your child is, what you all need, and the style of the clinician. Now, there are some cases where your clinician may be able to give you a very specific number. They may be using, for example, a manualized treatment that already has set session by session protocols to guide the work you're doing. So they may be able to say this therapy will last for 8 sessions. But in any case, we think that a collaborative discussion is really the key so that you and your clinician are on the same page about what to expect in terms of length of therapy. At the outset of therapy, setting very clear and specific goals can be very helpful, and that is going to give you a good sense of how long therapy might last or how to know where you are in the trajectory of therapy. So an example of a goal would be something that is specific enough that we would all know when that goal has been met. So in other words, what would you see being different? Are there behaviors that you'd like to see your child do more of or less of? Is it a subjective report that your child or you can describe feeling better, feeling more confident, feeling less worried? So that's a specific outcome as well. The key here, in our opinion, is that it should be something that is defined so that we know when we have reached that destination rather than we're just kind of wandering without a real clear end in sight. A second consideration is something we call progress monitoring. Essentially, this is keeping track in some way of session by session or every now and then, are we moving in the right direction? There are a few ways to think about this. One, the most simple way, is just through subjective report. This is where on a regular basis, the clinician and the client, and potentially with input from caregivers or others who know the client, are weighing in on, do things seem to be changing? Does the child feel better? Are they feeling less worried? Are they feeling more energetic? Are they being more attentive at school? Do they feel better able to get their work done? So the subjective report can be very important. Another way to think about this is by using measurement tools. By measurement tools, these are largely self-report measures that might ask very structured questions. You might be able to get a score on one of these kinds of questionnaires. There's also caregiver and teacher report forms that can be used to gauge progress. So whether it be through subjective report or more formal measurement tools, we do really encourage monitoring progress as we go. And finally, the third consideration is how do we go about deciding that it is time to go ahead and take a break or stop therapy? We really believe that this should be a collaborative discussion. It's how do we do that? What does that mean to have a collaborative conversation? Well, here, of course, we're talking about multiple sources of input. Very importantly, of course, is the client themselves. How are they feeling in terms of their progress towards their therapy goals? Factoring in input from the parent or the caregiver is also critically important. It should be something ideally that's planned in advance whenever possible so that we know what will our final session be. What will that look like? Will it be a gradual tapering of visit frequency so that we're starting to spread sessions out to maybe every few weeks, every month? Will there be quarterly check-ins? Or will it be a more clear, this is our last session, we don't plan anymore, you're welcome to call me again? In any event, we think that the decision to stop therapy should really be done through collaborative discussion. In conclusion, we think therapy can be a very positive and productive experience for your child and your family. We're really glad you've taken the step and that you are engaging or considering engaging with a clinician here at the clinic. Length of therapy, there's no one size fits all here. We think that setting clear goals in collaboration with your clinician monitoring progress as you go, and then having a collaborative conversation when you're approaching the end of therapy is really going to help you get the most out of your experience here at Children's Program.